Hello guys, today you are going to learn how to confirm whether or not you are ovulating. If I am to win a penny anytime someone tells me I don't think I am ovulating, I'll be a millionaire at the moment. But before then, what is ovulation? Hello guys, welcome back to my channel. I am the Wonga Nation President, and the topic today is how to confirm ovulation, which is one of the things that a lot of ladies are concerned about, especially those who are trying to conceive. Ovulation is the release of matured follicle from your ovary. This is a very important process in your fertility. Ovulation involves your ovary releasing a matured egg. The eggs you have now has been there since the day you were born. So if you are 32 years old, that means you have your eggs since 32 years. So your eggs are very important to you, and it is something that you really need to study and understand properly. So on a cyclical basis, once you enter puberty, you are going to be recruiting eggs in your ovary. These eggs are called primordial follicles. The primordial follicles will continue to grow in your ovaries until one of them grows more than the others, just like in survival of the fittest or in a sport where one person emerges the winner. The dominant follicle will emerge the winner in this race of primordial follicles, and once it emerges the winner, it is called dominant follicle. The dominant follicle is usually the biggest egg of the month, and this biggest egg is like a queen in her own dynasty. She is very beautiful, and she waits in your fallopian tube for a sperm to come and fertilize it. If fertilization occurs, then you are going to get pregnant. If not, then pregnancy will not occur in that month, and 14 days later you are going to get your period. So ovulation is when this dominant follicle pops out of your ovary. Some people can have signs and symptoms when the time is near. Things like tenderness of your breast, having one-sided lower abdominal pain, changes in your sense of smell, and also have urge for your partner. These are some of the signs that some people would have during the time of their ovulation. However, some people don't get signs, and then they're worried that they are not ovulating. So today I will teach you ways you can know whether or not you are ovulating. Number one way you can know if ovulation is truly occurring inside of your ovary is by doing a progesterone test. Progesterone testing helps to figure out whether or not ovulation is truly happening. And how is that? After you ovulate, there is usually something remaining in your ovary. This is called the corpus luteum. The corpus luteum is there in your ovary to produce progesterone, and this progesterone is necessary because in your first trimester of pregnancy, it will help to stop contraction and relaxation of uterus, hence making you to stay pregnant. So also, testing this progesterone level can help your doctors to figure out truly if you are ovulating or not. This test is usually done 7 days before your next period, because that is when your progesterone level is expected to be at its peak. Number two is the use of ultrasound. Scan is another way to confirm ovulation. And how is this done? Through follicular tracking. Remember, the follicles grow and one becomes the dominant. So what scan is looking for is the dominant follicle. Throughout your cycle, you are going to go for scans at particular days, and this scan is going to monitor the dominant follicle until it sheds off from your ovary. And once your sonographer is able to see that that dominant follicle has left your ovary, then it can be confirmed truly that you have ovulated. Number three is doing a progesterone urine test at home. There are progesterone test strips that you can get from your local pharmacy or from your local store. You can do this test at the comfort of your home. It also confirms truly if you are ovulating or not. But the sensitivity is not as that which can be done in the laboratory in a hospital. Another way to confirm ovulation is with the use of basal body temperature tracking. This involves being patient and also being very disciplined, because you will need to be taking your basal body temperature reading on a daily basis from the beginning of your cycle until the time you ovulate. And how do you know whether you've ovulated using the basal body temperature? By the shift in temperature. Once you ovulate, due to the influence of progesterone, your basal body temperature is going to increase. So doing a basal body temperature testing every day until you notice this change in basal body temperature, then you can confirm truly that you have ovulated. With the use of ovulation test strip. Ovulation test strip is simply a predictor of ovulation. It doesn't really confirm whether that follicle is leaving your ovary or not. Ladies with polycystic ovarian syndrome can have a positive ovulation test without the egg leaving their ovary. So when you are using the ovulation test strip, just know that it is predicting, it is not confirming. Another way is monitoring your cervical mucus. By the time you notice your fertile cervical mucus in your cycle, it is predicting that your ovulation is near. It is not also a confirmation that the dominant follicle has left your ovary. So to confirm, it is either using progesterone tests, ultrasound, or basal body temperature. I hope this video helps all of you. I am still your Wonga Nation president, and I will see you all in my next video. Bye.